What thyroid problems cause voice changes and hoarseness? Have you ever noticed your voice sounding different or a persistent hoarseness that just won't go away? Sometimes, issues with the thyroid gland can be behind these voice changes. The thyroid is a butterfly-shaped gland in your neck that plays a key role in hormone production, and when it's not working properly, it can affect your voice in several ways. One common thyroid problem linked to voice changes is hypothyroidism, which is when the thyroid produces too little hormone. This condition can cause the vocal cords to become thickened because of fluid buildup, a condition called myxedema. When the vocal cords are thicker, they don't vibrate as smoothly, leading to hoarseness, a rough voice, or a lower pitch. People with hypothyroidism may also experience vocal fatigue or a feeling of the voice tiring easily. Sometimes, the enlarged thyroid gland, known as a goiter, can press on nearby nerves or muscles that control the voice, further contributing to hoarseness. These voice symptoms tend to develop gradually and can improve once thyroid hormone levels are balanced with appropriate treatment, but it may take several months for full recovery. Another cause is thyroid nodules or an enlarged thyroid gland. Large nodules or goiters can physically press against the vocal cords or the nerves that control them. This pressure can cause the voice to become hoarser or even cause difficulty swallowing or breathing in severe cases. Sometimes, these nodules produce excess thyroid hormone, but the main issue with voice is usually mechanical pressure on the vocal structures. Thyroid cancer is also a potential cause of voice changes. When a tumor develops in the thyroid gland, it can alter the shape of the gland and put pressure on the voice box or larynx. In some cases, the cancer can invade or damage the recurrent laryngeal nerve, which is responsible for moving the vocal cords. Damage to this nerve can lead to paralysis of one or both vocal cords, resulting in persistent hoarseness or changes in voice pitch and loudness. Because the thyroid is so close to the voice box, any malignancy in this area can directly affect how your voice sounds. Less commonly, overactive thyroid or hyperthyroidism can also influence the voice, but usually not cause hoarseness. Instead, it might cause a tremulous or jittery voice due to increased muscle activity and metabolism. It's important to remember that hoarseness and voice changes can also stem from other causes like infections, injury to the vocal cords, neurological issues, or acid reflux. Because of this, a thorough medical evaluation is essential to determine the exact cause. If you notice persistent hoarseness or voice changes, especially if they last more than 2 weeks, it's best to see a healthcare professional. They can assess whether your thyroid is involved and recommend appropriate tests or treatments. Managing the underlying thyroid condition often helps improve voice symptoms, but if nerve damage or tumors are involved, additional medical or surgical interventions might be necessary. Always seek personalized advice from your doctor to ensure proper diagnosis and care.